Hi everyone, and welcome to today's virtual event, Introduction to the School-Based Services Readiness Checklist. My name is Caitlin Carney, and I'm with the Medicaid School-Based Services Technical Assistance Center. For today's event, we are excited to share the Readiness Checklist with you all. I'm confident this tool will help make your work easier. We've scoured every inch of the guide, reviewed federal regulations and CMS guidance to get the requirements in one place. We worked with over 5 teams across CMS to design this tool to offer you a step-by-step guide and help you feel confident as you update your state plan amendment and time study implementation plan. So here's what we have in store for you today. Soon I'll welcome our presenters and share the objectives of today's session. Then Kate Guinness from CMS will share a few words celebrating the Bipartisan Safer Communities Act, which has made this work possible. And then I'll turn it over to Rachel from the SBS TA Center, who will introduce the Readiness Checklist and how it can be used. Then Rachel will walk us through a live demonstration of the tool. And after that, we'll talk with a state who got to pilot the Readiness Checklist and hear about their experience and lessons learned. Finally, you'll find out next steps, including where you can access this tool, an announcement of some resources that were posted earlier today to Medicaid.gov, and you'll have the opportunity to ask questions about the Readiness Checklist. We welcome you to use the Q&A function on Zoom at any time during the presentation to drop in any questions you may have about the Readiness Checklist or the state's experience. And to head off some of our most frequently asked questions, please note this meeting is being recorded and both the slides and recording will be posted to Medicaid.gov. So as I mentioned, my name is Caitlin Carney. I'm kicking us off, wrapping us up, and helping with the Q&A today. I'm with the School-Based Services TA Center and previously oversaw Massachusetts School-Based Services program for about 5 years. Rachel Barron Van Cleve is also part of the TA Center and is the lead author of the Readiness Checklist. Rachel has worked with CMS and developed TA materials for state Medicaid agencies for several years and previously worked for the New York State Medicaid Agency. And finally, we have Amy Holberg from the Rhode Island Executive Office of Health and Human Services, where she is a policy director for Medicaid. Rachel will tell you more about Amy in a little bit before they talk about Rhode Island's experience with the Readiness Checklist. In terms of our objectives today, it's really pretty simple. By the end of today's session, you'll understand how to use the SBS Readiness Checklist to support expansion of the school Medicaid program, compliance with CMS guidance, and other tasks. We'll also identify key takeaways of utilizing the SBS Readiness Checklist to support the evolution of a Medicaid SBS program. But first, I'm going to pass it over to Kate Guinness, who I consider to be a true champion for children's health. Kate is a senior policy advisor for children and youth within the Office of the Center Director at the Center for Medicaid and CHIP Services. Kate?
Thank you, Caitlin. And I'm delighted to be here, and I'm glad you consider me a champion for kids, and I certainly am a champion of this work and feel grateful to be at CMCS and be able to be part of what is really just been a great body of work to support kids in schools and states in getting services to kids. As you can see, we are almost at the 2-year anniversary of the signing of the Bipartisan Safer Communities Act. Since that time, folks at CMCS, I arrived at CMCS in February last year. CMCS was already hard at work in the development of the policy related to really updating and modernizing the guidance related to delivering services in school-based settings. In August of 22, there was an informational bulletin that was a foreshadowing of things to come when in May in 2023, the very comprehensive, the super guide, as some were referring to it, was issued. That really has been, I would say, the platform from which the rest of the work has flowed. The TA Center launched in June, and we have been working very closely sort of since the act was signed. CMS and the Department of Education have been working really closely because we know that this is something that is happening where Medicaid and the Department of Education need to be sort of hand in glove to make it work for states and for state education agencies and for schools. In January of this year, we issued the notice of funding opportunity for the school-based services grants, which are there was $50 million included in the Bipartisan Safer Communities Act for those grants, and we anticipate that those grants will be issued sometime in late Q2 or early Q3 of this year. So we're thrilled that grant is sort of the last piece of implementation for us of the Bipartisan Safer Communities Act, and that those grants will help states support them in coming into compliance with the broad array of policies that were issued in the super guide. So with that, I will turn it back over to Caitlin, and we'll get the show on the road. Thank you.
Thanks, Kate. And I'm actually going to turn it over to Rachel.
Thank you, Caitlin and Kate. I'm also really glad to be part of this work. So the tool we're introducing today aligns with the 2023 comprehensive guide that Kate described and an accompanying CMCS informational bulletin, or SIB. What do the SIB and comprehensive guide do? They encourage states to expand their school Medicaid programs beyond individualized education programs to include more students and more services. The documents identify new flexibilities to reduce administrative burden, and they also clarify CMS's requirements for payments to school-based providers. The flexibilities are optional, but states must comply with the requirements by July 1st, 2026. And I'll explain how the Readiness Checklist can help. The School-Based Services Readiness Checklist is actually a set of checklists in an Excel workbook to help with 5 tasks: drafting a Medicaid state plan amendment, or SPA, adopting flexibilities, assessing compliance, preparing a time study implementation plan, or TSIP, and discussing plans with state agencies and CMS. These tasks, like preparing a state plan amendment, are generally the responsibility of the state Medicaid agency, so we anticipate state Medicaid agencies will use this tool. Hopefully, state and local education agencies are also part of conversations and planning leading up to a state plan amendment, but we do not anticipate they would use this tool. The Readiness Checklist is voluntary. It does not supersede federal guidance. It's not intended for other programs outside school-based services, and it focuses on the Medicaid state plan, but you may also need to consider managed care contracts, CHIP, or waivers. If you work for a state Medicaid agency, you might use the Readiness Checklist if you're already familiar with SPAs and you want to learn more about school-based services, or if you're already familiar with school-based services and want to understand SPAs and other program documents. This tool can be helpful for program staff who oversee school-based services, or it can be a reference to legal, finance, and policy staff who support SPA submission and implementation. School-based services SPAs follow normal procedures, but there are expectations specific to school-based services for the coverage and reimbursement pages. And similarly, if you're familiar with time studies in other contexts, know that there are unique features of school-based services time studies. And so in a moment, I will switch to Excel and show you the structure of the Readiness Checklist and how you can use it for 3 use cases. But first, I'll say a little bit more about each case. The first use case is drafting a SPA. This tool can help you draft an approvable SPA package, and this is the first use case you'll see in the demonstration. When would you need a SPA for school-based services? Perhaps to expand services, perhaps, for example, adding behavioral health services, to add populations, going beyond IEP students, or to add authorized providers, to change your payment methodology or interim payment methodology, or if you've significantly changed the time study, you'd also need to update your state plan accordingly. The Readiness Checklist can help you assess compliance, and this is the second use case you'll see in the demonstration. Regardless of whether the state plan of whether the state plans to change population or services, all states must ensure their payment methodology complies with the comprehensive guide and federal cost principles by July 1st, 2026. You can compare your current state plan language around payment methodology to the requirements in the readiness checklist as one way of assessing whether your payment methodology is in compliance. You can use the school-based services readiness checklist to develop an approvable TSIP, and this is the third use case you'll see in the demonstration. So this gets technical, but you will need to update the TSIP if you will change the sample size or other methods in your time study, add services or providers to the school Medicaid program, or if you're expanding your TSIP beyond administrative activities to include direct services, which you would do if you're going to start paying direct services using a reconciled cost methodology for the first time. And even if your state is not initiating any of these changes, you might still need to update the TSIP to meet the requirements in the comprehensive guide for no more than 2 days notice and 2 days response window. We'll now switch to Excel, and I'll walk you through how the checklist is organized and how you would use it for these 3 use cases. Okay, so you're looking at the school-based services readiness checklist. This is a draft that might change slightly before dissemination. We're starting in the table of contents, and you can see there are there are many tabs in this workbook, starting with a tab for acronyms and an introduction. Tab 1 lists the documents required or recommended in a school-based services SPA package. And the remaining tabs are grouped by topic. Generally, a topic is a document included in a SPA package. We have public notice, tribal consultation, coverage pages of a SPA, reimbursement pages, supporting documents, including a time study implementation plan, and interagency agreements for Medicaid administrative claiming. Time study plan could be a supporting document to a SPA, or if you're revising the TSIP, it could be its own submission. And then the final tabs describe flexibilities for third-party liability. For each topic, there are at least 2 tabs. There's an overview and a list of requirements. And I'm going to click on a sample overview tab to show you what it looks like. So you're looking at the overview tab for the topic of Medicaid State Plan Attachment 419B, also called the reimbursement pages. And for any given topic, I recommend you start with the overview tab. The overview tab gives instructions, and then documents covers the purpose of the document, when it is required, the format for submission to CMS, and associated regulations or guidance, state examples, and tips. And now I'm going to click over to tab 5.2. And this is an example of a requirements tab. This is the requirements tab for the same topic, attachment 419B. This includes a list of required information. For example, the 419B pages of a school-based services SPA should always start with a list of the Medicaid services that will be provided in the school setting. And then you can look at the next column for additional instructions. For example, for this item, you should verify that all the school-based services you listed are covered Medicaid services in the Medicaid state plan. As you go through the checklist, you can track the requirements you meet in the readiness column. There's a drop-down menu, and you can select yes or no. This is just for your own use, internal use and tracking. And then you can, in the last column, you can add any notes. If you want to print a tab, you can click on the for print hyperlink. And this takes you to a print-ready version of the same content. I'll just scroll down to show you what that looks like. It's just formatted to fit on a page. Heading back to the table of contents. So that's how it's organized. And now I'm going to walk through those same 3 use cases. First use case is drafting a SPA. If the state is submitting a SPA, begin with tab 1 for the SPA package. This lists the documents in a SPA package and when they are required. For example, we have public notice, tribal consultation, the SPA pages, and supporting documents. For example, if you are submitting a reimbursement SPA to change the payment methodology, you can then click on the hyperlink that will take you to the tabs describing the reimbursement pages. I'll click on that hyperlink. And we're back on the overview tab for reimbursement pages. I always recommend starting with the overview page. And then on the next tab, you can see the specific requirements for those SPA pages. Again, you're seeing the required information and additional instructions. So the next use case is assessing compliance of your payment methodology, and we're actually going to stay right here on tab 5.2. When you're ready to assess compliance, open up your Medicaid state plan and find the school-based services language in attachment 419B. Compare your current language to the requirements and use the readiness column to mark the requirements met. Make sure you read the section corresponding to the payment methodology your state uses. For example, there's a section for the fee-for-service rate methodology, the cost-based rate methodology, and the reconciled cost methodology. And when you're done with tab 5.2, go to tab 5.3 and check that your specialized transportation payment methodology is also in compliance. If you find that the payment methodology described in your state plan does not meet all CMS expectations, you can reach out to the SBS TAC mailbox for support. The last use case for today is updating a school-based services claiming time study implementation plan. And the readiness checklist assumes you're using a random moment time study. In the readiness checklist, you'll use tabs 6.1 to 6.3. I'm clicking into tab 6.1. Again, I recommend you start by reading the overview tab. Use tab 6.2 to learn the requirements for a random moment time study. For example, your time study should include administrative services payable by Medicaid if you're participating in Medicaid administrative claiming, and direct services if you use a reconciled cost methodology for direct services claiming. Expanding a little bit on, it says if applicable here. And the next column includes steps to plan your time study. For example, you'll need to list all administrative activities and direct services performed in schools and map them to activity codes. And again, you can use the readiness column to track the requirements you've met. Oh, I just wanted to show you one more thing here. So the second row in this tab in 6.2 is for sampling plan methodology. The first column again describes requirements, and the next column gives you steps to determine how you'll meet those requirements, like identifying your sample size, determining the approach for vacancies and substitutions. So there's more detail for the requirements than the steps break it down. It's a lot. Start here, first do this, then do that. This tab tells you what the requirements are and how to plan it. But then when you're ready to actually write your TSIP, go to tab 6.3. So this tab can help you write your TSIP or check whether your TSIP includes all the relevant information. You can choose how to organize your TSIP and whether to use these optional headers, but they're presented to give you one possible way that you can organize the information. If your TSIP doesn't match with this format or you don't think these headers would work for your state, that's completely fine. What we've done in the information to include column is translate the time study requirements and steps from tab 6.2 and what you would actually write in the TSIP. For example, I'm going to scroll down to row 3F, which is the sampling requirements. So if we saw if there were steps to plan your sampling methodology, in the previous tab here, it tells you what you actually need to describe in the TSIP, like describe the level of precision and the confidence level, all those things that you've decided in the previous tab. And once you have included that information, you can mark yes in the readiness column. So this concludes the Excel portion of today's presentation. The school-based services readiness checklist includes all of these instructions, so don't worry if you didn't write everything down today, and we can return to the slides. So let's spotlight how one state plans to use the readiness checklist. I am excited to welcome Amy Holberg to join me. Amy and her colleagues in Rhode Island piloted the readiness checklist and will share how Rhode Island will use the checklist to support expansion of their school Medicaid program. As a policy director for Medicaid, Amy focuses on children and behavioral health. She previously worked with healthcare leaders across the country to address health-related social needs and co-authored 3 studies looking at the clinical impact of social needs screening and referral programs in primary care settings. In her current work related to school-based services, Amy is leveraging her experiences working directly with children, families, and school systems. If you have any questions for Amy or other questions about the readiness checklist, please add to the Q&A box and we'll answer questions after this state spotlight. So Amy, thanks so much for piloting the checklist and welcome.
Thank you.
So as context for how you'll be using the checklist, could you explain what changes Rhode Island is considering for its school-based services program?
Yeah, I would love to, and I'm excited to be joining you all and sharing our experience. So about 2 years ago, Rhode Island was conducting our system of care work, looking at children's behavioral health. And in a meeting, a lot of stakeholders had discussed the need for additional children's behavioral health services in schools. And that kind of began our journey here at Medicaid to understand, what was currently true about our school-based services program and to really define what the problem was, so we could improve our outcomes for kids' mental health issues and behavioral health issues here. So as many policy people out there know, like the problem definition is key. And what we realized is that, our school-based services program really was only reimbursing for services authorized under an IEP. And as part of that journey, a lot of the federal guidance and tools had started to come out, and we realized that we had a big opportunity here to expand our school-based services program. So what we are working on now is expanding to cover services outside of an IEP for all populations, for all Medicaid covered services. We also, as part of that, explored our own statute and regulatory pathway. Rhode Island currently authorizes school-based services under EPSDT, so we don't have a state plan. So we're going to be working on submitting a state plan, which is why the readiness checklist was really fundamental for us, and understanding all of the steps and the decisions that were needed so that we could expand beyond an IEP and cover all Medicaid services for all Medicaid kids in schools.
That's so exciting, Amy, and I'm really honored to be working just tangentially with you on this. So as the state makes these changes, who within Medicaid or the Rhode Island Department of Education is going to use the SBS readiness checklist, and how will they use it?
So currently, we don't have a dedicated staff member to school-based services here. So it's myself and a colleague on the policy team. We've engaged with our finance team to really look at the flexibilities that are available around reimbursement to determine whether we're going to continue with cost-based or start with claims-based or move to some kind of cost reconciliation. And then working with our Rhode Island Department of Education colleagues who support school-based services. So we can bring kind of those key decisions that I think the checklist really calls out in a really important way, to make sure that we're aligned with our, Department of Ed folks, as well as stakeholders from our LEAs across the state.
Awesome. So it sounds like you don't have dedicated staff, but there are many people from state Medicaid and Ed who are going to be working together, and that the readiness checklist has helped you figure out what the conversation topics can be.
Exactly. And I think because we don't have a dedicated person for school-based services, it helps, our Medicaid director understand how to leverage the staffing that we currently have, kind of to take this desire into a reality, and which other teams here, again, from our finance to our legal team on the ISA side, kind of what is really going to be needed on the Medicaid agency in order to accomplish it.
Yeah. So you've mentioned a few things, but can you say any more about what will be useful about the tool and how you plan to use the readiness checklist before, during, and after the SPA submission?
Yeah, I think the tool itself, I think, is great for multiple reasons. I think really drilling down and understanding, like distilling the information from the bulletin and the guidance documents, so we can make, those key decisions in order for us to submit the SPA, as well as the planning needed to either get to those decisions, or if we make the decision, what work is needed here. So I think from a decision-making planning, kind of project management perspective, the tool is really, really useful, especially if you don't have the human capital, at your state Medicaid agency. And then in terms of the process steps that are needed, from, the amazing detail around submitting a SPA to the tribal notice, which Medicaid agencies might be more comfortable with, to the things that we're maybe less comfortable with around the time study implementation or kind of nuances around compliance. So those process steps along the way. And then I see it as being really helpful for us in the future to ensure that we're meeting those compliance requirements under the new guidance. That we'll have those kind of embedded as we're planning and as we're submitting our SPA, but also a great document for us to use for oversight on the future.
Awesome. That's wonderful. Do you have any suggestions for states that might use this tool?
Yeah, I think it was really helpful for us because we're at the beginning of a process to use it at the beginning, especially in conversations, again, with our Department of Ed and stakeholders, and internally around those key decisions that leadership has to make at Medicaid. So, for us, I think it's use it early and use it often. But even states where maybe there's more robust school-based services, or maybe you've expanded to a certain population or a service, I think it's really helpful in terms of ensuring that compliance with the updated guidance, and also just provides a really distilled, easily accessible way to kind of understand each process step, for kind of project planning and management as you're working on submitting a new SPA.
Thanks so much. So Amy will be available for questions about Rhode Island's plans for school-based services, or how Rhode Island will use the readiness checklist in the upcoming Q&A period. And thanks so much, Amy, for being here and for helping us pilot this tool.
Yeah, thanks for letting Rhode Island pilot, and excited to see it be used by others.
Yeah. Okay, so when and where can you get the school-based services readiness checklist, which by now I'm hoping you want to do? It will be posted to the School-Based Services TA Center's website on Medicaid.gov soon, and sent to the TA Center's distribution list. We also want to note that our TA Center website has been updated with new resources to promote understanding of specific topics, and we welcome you to visit the website and review these resources. These include understanding cost pools, a job aid on how to answer a random moment time study, reimbursement for specialized transportation within Medicaid SBS, Medicaid school-based services federal documentation requirements for LEAs, and considerations for developing a time study implementation plan. So a wealth of resources just went up today. In addition, slides and summary handouts from previous webinars have been added, and there'll be a few additional webinar recordings coming soon. So there's a lot there right now. The readiness checklist, that's the topic of this webinar, is not up there yet, but it will be there soon. And we'll send a message to the TAC distribution list when it's up, so you don't miss it. If you have any questions as you use the tool, please email the School-Based Services TA Center at schoolbasedservices@cms.hhs.gov. And I'll turn it over to Caitlin to facilitate Q&A. So Caitlin, back to you.
Great. Thank you. So great to hear from both you and Amy on this tool. So as a reminder, please enter your questions in the Q&A function at the bottom of your screen on Zoom. And you're welcome to ask about the readiness checklist, Rhode Island's plan for their school-based services SPA, and their experience with the checklist itself. We've had a few come in, and some of them, and you'll note, have been answered in writing. And so I just want to share that, you know, in terms of how the readiness checklist addresses a certain policy, we want to emphasize that there are no new policies or requirements in this checklist. Instead, the aim is to help you avoid what can sometimes feel like a scavenger hunt and put all the information in one place. In fact, there's a reference for every requirement, and it'll show you where it comes from in federal regulations or the comprehensive guides. So no new requirements here. Really, this tool is ultimately to help you organize yourselves and your policy documents. So just want to underscore that from the questions we've gotten so far. Okay, and one question is, actually this one is kind of a fun one. Is there anything, Amy, that you learned using the checklist that surprised you?
Yeah, Caitlin, I think probably a lot surprised me. I think for us, what we walked away with was really a clear understanding of where there were requirements and where there were flexibilities. And I think that was an understanding we didn't walk into the tool having. It was also a great reminder for us because we only cover right now IEP related services that we have to think about TPL. So a surprise because we just hadn't considered it until we received the checklist, and really grateful that it was there so we could start planning and thinking about TPL.
And TPL, as folks probably know, is third-party liability.
Thanks, Rachel.
Yeah.
Even after all these years, sometimes it's hard to come off of mute. There's also a question about, I think, just looking for confirmation that under your current state plan, can providers seek reimbursement for services outside of an IEP, or is it only pursuant to an IEP?
Yeah, so in Rhode Island, we don't have a state plan right now for school-based services. We authorize it under EPSDT. So external providers, so a community-based provider could work within a school and bill Medicaid kind of as their provider type. We're working on expanding what the LEAs can claim for the delivery of services outside of an IEP themselves.
Great. And then we had a question about consultation or working with the SEA and the LEA. And whether it's required to collaborate. I don't think it's technically required, but I'm wondering if you spoke about this already, and it's okay if you don't have anything else to add, but just if there are aspects of your collaboration with the SEA and the LEA as it relates to the SPA submission process, or how this checklist can be used to help with the collaboration. Maybe that's, hopefully having this can help with the collaboration, even if it's not like strictly required under federal rules or anything like that.
Yeah, I can say that the collaboration, early with our Department of Ed and with the LEAs was really important in terms of our future hope for implementation success, especially around the time study or the administrative lift on the LEAs, and also what their hopes and desires are, but really important for us to have those engagements and ongoing conversations, because so much of the program is, the LEAs and our Department of Ed working to ensure that, Medicaid is in compliance. So I think, although not a requirement, it would be really difficult for me to see not collaborating with them around some of kind of the bigger key decisions, and then kind of the technical aspects of implementing either a new time study or how they're going to, capture and understand Medicaid eligibility. So I just think there's a lot of ripe learning there for Medicaid. It's also a great way for Medicaid to be able to talk to schools and to their Department of Ed about kind of the Medicaid perspective and Medicaid rules and requirements and why things look the way that they do. So really would utilize the checklist is a great place to kind of bring those kind of really distilled points to those kind of stakeholders to start a conversation and build those relationships.
Awesome. And there was a question that Richard actually answered, but I am going to read the question and answer, and then Rachel, a preview, I'm going to ask if you have anything to add to Richard's answer, actually. So the question was, does the school readiness checklist include options to suspend or terminate TPL efforts? And Richard said that the checklist reiterates the guide policies, which is true for every single tab and every single aspect within the readiness checklist in a nice checklist format. So for the TPL policies themselves, see the guide. But Rachel, is there anything you wanted to add about how the readiness checklist does this? Or, I'm a little biased, but I think it laid it out in a way that's a little bit, that can be helpful with digesting the guidance. So I'm curious if you have anything to add.
Yeah, would it be helpful actually for me to screen share the page of the readiness checklist about TPL?
I think that would be great. And I think we've gotten a couple questions on this, so let's do it.
Okay, I'm just zooming that and scrolling to get it in the right spot. And okay, so here's the overview tab for TPL, and it covers 4 flexibilities around TPL. Same content as the guide, just organized a little differently. So those flexibilities do include suspending or terminating recovery efforts if they're not cost effective. Exempting specific services from third-party billing if you can document that the service is never covered. And prioritizing certain diagnosis codes. This one is indicative of trauma over others, probably less relevant for a school-based setting. And then the flexibility for the state education agency to pay a third party's liability using its own funds. So these are all from the guide. And in tab 8.2, we spell out if you're going to use any of these flexibilities, what would you do? So a couple of these you would implement. You probably already have language in the state plan that governs your ability to implement. If you needed to update that in the state plan, there's instructions here. It's probably already covered in your state plan. And so the 2 parts that relate to the state plan are covered here. And to exempt never covered services from third-party billing. This information comes from the Coordination of Benefits and Third-Party Liability Handbook that's on Medicaid.gov, and we've summarized it here and included a reference to the guide. It's a link to the guide itself in our overview tab. This is probably the most relevant for school-based services, this number 3 here. And then also we've got a little bit of information, a teaser here on if the state education agency will cover third-party liabilities with its own fund. A little bit of what we know there. There may be more requirements. So we've gone into it in a little bit more detail, combining what's in the guide, the comprehensive guide for school-based services, with some information from that's also publicly available on coordination of benefits and third-party liability. And hopefully what's here can get you started, and we welcome questions. We're sure there'll be more questions. Send them on to the school-based services TAC mailbox.
Awesome. Thanks, Rachel, for walking through that. And I think, yeah, as you laid out, there's different options ahead of us with figuring out how to handle TPL. And so hopefully this can help at least start internal conversations with what might work best for us. We're coming up on time, and so we've gotten some other questions, and if you're always welcome to submit them to the TAC. So we're not saying they are not important because we don't have time to get to them today. Instead, please email us. Please email us with those questions, and then we'll get back to you. All right. I think that's pretty much it, other than to thank you for coming. Amy, Rachel, thank you for sharing. And I hope you're excited about this forthcoming tool. We can't wait for you to try it out. So be on the lookout for an email letting you know when it's online. And in the meantime, please check out the website for those 5 new resources and have a wonderful summer. Take care, everybody.